Julie is a patient of mine that I met, unfortunately, after she had a heart attack. She actually had 2 heart attacks, believe it or not, at the age of 37.
I was getting ready for work one morning and probably running a little later than I wanted to. So I was getting ready, and I remember feeling rushed or being rushed, but the feeling was all in here, and then it just kept compounding. And this heaviness, I wasn't breathing deep. A heaviness was just resting on my chest, and I couldn't make it go away, and I couldn't feel better.
Julie went in with chest discomfort. They told her she had pneumonia. And she said, well, I don't even have a cough. How could I have pneumonia? And they said, well, take this antibiotic and let us know how you feel in a few days. So the next day, same thing. The chest pressure is worse. So she goes in, and this was just last year. This isn't in 1957. This is in 2012 in a metropolitan city. She goes in again, and it wasn't till her second visit that they finally determined that indeed this poor 37-year-old mother of a 3-year-old daughter is having a heart attack. So she's treated now for her vascular disease, but when she first came in to see me, the tears and the issue were not because of pain, it was because of fear. She had no idea why on earth she had a heart attack. Why would she? She's a beautiful, fit, healthy 37-year-old mother of a toddler that says she's been told she's healthy her whole entire life. Why on earth did she have a heart attack? And so with the knowledge that we have of what causes vascular disease, it was with that education and that knowledge that Julie finally understands what caused her vascular disease, and we're treating that, and we're measuring the inflammation to know that our treatment is working, so she can proceed with life in confidence to know that that won't happen again. Most recently, however, I was doing Julie's inflammatory labs, and all of a sudden I saw a spike. Some inflammatory labs can be thrown off if you stub your toe, if you have a sore throat. This one really means something. It's a player in the disease state. So when this lab value is elevated, it tells me objectively that something is starting to tread on our territory of vascular stability. So that's when I pulled Julie in the office and I said, gosh, do you have anything inflammatory going on?
She said, this inflammation has got to be coming from somewhere. What is going on inside of you? She said, are you sick? Did you sprain an ankle? Anything? And I said, no, nothing. And she said, do you have a tooth that's bothering you? And I said, yes. Yes, I do.
And I said, well, let's investigate that further. Let's go back to your dentist and let me call your dentist. So that's indeed what I did, and we talked, and I said, this inflammation is being driven by something other than the common vascular risk factors that I'm treating for Julie. Can you please look a little deeper into that tooth that's been bugging her? Sent her to an endodontist who ended up doing a root canal, and it was found out that that tooth was horribly infected. Now the root canal has been treated, she's got the infection eradicated, and then doing her repeat inflammatory labs, I can now see that the inflammation is now mitigated, and onward we go. But it was really that tooth infection that really drove her vascular risk. And for someone like Julie, who had a heart attack unknowingly, we want to make sure that we just erase any chance of any vascular inflammation, including the oral systemic connection.